The older patient is more likely to have multiple diseases, and the older patient is also more likely to have less reserve, less cardiac, pulmonary, or lung, but also less apt to have mental reserve. The incidence of memory loss and other mental problems increase dramatically as we age. So the 80-year-old is much more likely to become confused during a hospitalization than the 50-year-old.
The goal of the Daily Visitor program is to try to keep the older person fully oriented throughout their hospital stay. So in other words, knowledgeable about where they are, what the date is, who the staff are that are taking care of them, and also to try to address any questions or concerns that they have as well.
The Daily Visitor program is an opportunity for patients to get information that will help prevent confusion from developing, give them a greater sense of control during their hospital stay, and allow them to voice concerns. Although designed to appear conversational, the Daily Visitor routine is a carefully planned communications approach that should be followed consistently. Before entering the room, volunteers should make sure their name tags are visible and that they have washed their hands.
Good afternoon, Mrs. Morris. I'm Betsy Robison, the Elder Life volunteer for the day.
Greet the patient by name and introduce yourself as a daily visitor with the hospital Elder Life program.
You are. What's the matter?
My bed's too low. And
I can fix that.
My glasses.
It is also helpful to remind them that the Elder Life program will assist them during their hospital stay.
Oh, your glasses are very dirty, too.
Oh, thank you.
During the initial greeting stage with the patient, the volunteer should check on such things as whether or not the patient wears glasses or a hearing aid. Help the patient put them on or adjust them. If the patient needs vision correction but does not have glasses or did not bring them to the hospital, the Elder Life specialist will get a magnifier for the patient to use. The volunteer can encourage its use.
Oh, yes, much better.
For vision-impaired patients, it is important to check that glasses are clean and fitting properly. Help them use a magnifier as needed and assure that there is adequate lighting. You can also help by reading instructions and menus and providing large type-printed materials. And because many of these patients may not ask you to repeat something they do not understand, you should check their comprehension of details throughout your visit by asking them to repeat key points in their own words.
Okay, this is the listinator I told you I would bring. And I'm going to put this around your neck. This way you won't have to hold it all the time while you're here.
For the hearing-impaired patient who does not have a hearing aid at the hospital, the Elder Life specialist will provide a listinator and help the patient to use it properly.
Put this on and turn the volume up a little bit. How is that? Can you hear me okay?
It's maybe a little loud.
A little loud. Okay, I'll turn it down a little bit. Okay, there. Now what you're going to...
The volunteer should reinforce its use with the patient.
Can I get your listinator for you?
Yeah.
It helps for Hospital Elder Life program volunteers to shut off the TV or radio during conversations with all the patients, but most especially with the hearing impaired.
If you don't mind, I'm going to turn the television off while we talk.
Oh, yes.
Okay. There's less confusion.
You may also want to close the door or pull the curtain to minimize noises and distractions. Speak slowly and clearly in a low-pitched voice. Avoid shouting. Face the patient and reinforce your verbal message with gestures. Make sure the patient understands what you are saying by asking them to repeat key points in their own words. The goal for every patient enrolled in the program is to make their hospital stay less confusing and more comfortable.
We try to set up a patient's room every time we go in.
Mrs. Morris, can I help you fasten your gown up?
Oh, thank you very much.
Sometimes they get a little undone while you're lying in bed.
Yes, they do.
Yeah, and your pillow's a little scroogey.
Yeah.
Do you want to lean forward?
The first thing we try to do is make sure that the patient is comfortable in the bed, that they're sitting somewhat upright. We don't want patients laying down all day. We want to make sure that lights are on, not the glaring, surgical kind of light, but that there's a light that's on, that they have enough covers, that they're covered properly, that their gowns aren't open, that they're, have some modesty, and we keep them as dignified as we can.
Hi, are you right-handed or left-handed?
I'm left-handed.
Oh, great.
Betsy.
We'll keep this here then.
Okay.
Then we try to make sure that they can reach, so we'll put the call bell, wrap it around the bed frame and put it right by their hand. If they're right or left-handed, we try to put it by their dominant hand so they can reach it. We try to make sure that their tray table is then beside the bed that has the things on it they need. Their glasses, their hearing aids, their tissues, and we try to put that right by the bedside at the level that their hand would reach out and actually touch. Put their flowers there so they can see them, put their cards there, open the cards so they can look at them, hang them up on the board if they want them displayed. If they have artwork from grandchildren, tape it up so they can look at it and make them feel better.
Families can help in the orienting process by being encouraged to bring familiar items from home, such as photos or religious items. After setting up the room, the volunteer should sit down facing the patient for a few minutes and ask if there are any questions or concerns.
Morning paper.
Your morning paper?
Yes.
You haven't gotten it yet?
Not yet.
It could be something as simple as making sure the room receives TV service or that the patient gets a newspaper, to something more complex, like anxiety about an upcoming test or procedure.
RI?
Mm-hmm.
Can you tell me what that is?
I can't explain what an MRI is, but I can contact your nurse and she can explain what it is.
The volunteer should never offer medical advice, but can make suggestions about who is the appropriate person to ask. The volunteer should write down questions and refer the matter to the patient's nurse or elder life specialist for further action.
In the meantime, I'm going to keep this pad and paper close by you if you have any questions or concerns.
Volunteers should make sure patients have paper and pencil within reach to write down their questions.
Because one of the things we found that's hardest for patients is they come into the hospital and they don't know what's going to happen to them. We try to minimize the mysteries.
Mrs. Morris, I'm going to update your board here, okay?
Thank you.
Today's not Tuesday, it's Wednesday.
To help take away some of the mystery of a hospital stay, the DailyVisitor program uses a very simple but effective technique with all its patients, the orientation board.
And it's the 12th of July, not the 11th. Your nurse this afternoon is Inger, and your PCA is Nikki.
All right.
Hospitals can be confusing places for any patient. There is a constant stream of medical personnel and staff. The routine, the room, even the bed are not the patient's own. The orientation board allows patients enrolled in the program to see that there is a routine during their stay and people who can help make their stay more comfortable.
Okay?
Thank you.
That should
I
clear up
understand
some
that.
things here.
Yes, it will.
You also have your test. Your MRI is at 2 o'clock.
Okay.
I'll put that down here as well.
The elder life specialist sets up the orientation board initially so that all a volunteer needs to do at each visit is update the information. The board should be placed where the patient can see it. Markings should be large enough for the patient to read easily and in a high contrast, such as black ink on a white background. The words Hospital Elder Life Program should be written across the top. Next should be the day of the week, month, date, and year, so that the patient doesn't lose track of time. Identifying any medical personnel they might be seeing during this shift is the next thing written on the board: doctors, nurses, and aides. Volunteers also write the name of the next volunteer scheduled to visit. On the other side of the board, write down the patient's schedule, such as any tests or procedures and any Hospital Elder Life Program activities that are scheduled. Include the times whenever possible. Finally, writing the meal times on the board provides another focal point for patients. The times may be quite different than what they have become used to prior to their hospitalization.
It kind of is a map to help them understand who's going to be seeing them and what to expect during the day. And that really takes away a lot of the fear.
I think you always need to smile a lot. And then you need to make people feel at ease, because if you look grim, of course they're going to think, my God, maybe there's something this person knows. Maybe there's something really wrong with me. But if you smile all the time, they feel very much at ease. And so that's very helpful, I find.
There are two types of patients who are more difficult to orient: the cognitively impaired or confused patient and the uncooperative patient. Both present challenges for volunteers during the DailyVisitor program. Tips for dealing with both are spelled out in the manual, but here are a few things that may happen with these patients. Cognitively impaired patients may be confused about their surroundings and need reorienting during the session.
I'm all right.
Oh, okay, that's good.
But nobody will tell me what's happening with the war in Europe. What's Roosevelt waiting for anyway?
Okay, Mr. Wilson, as you can read from your board, today is year 2000, and the war was over in 1945. Remember?
Oh.
Were you in that war?
Oh, yes, I was. Yes, I fought in Europe.
Oh, that's interesting.
Use the orientation board to reinforce simple ideas about where they are and what is happening. During conversations, use simple statements and questions. Present one question at a time. If a patient makes incorrect statements, be tactful, but try to reorient them. It is important to document whether you were able to reorient the patient during your session.
No, I'm not a doctor, Mr. Wilson. I'm a volunteer.
Hi, Mrs. Levine. It's me again. Hi. What's the matter?
Oh, don't bother me. It's my nap time.
Oh, but I'm here.
While the cognitively impaired patient may be willing to make conversation and simply be off track on details, the uncooperative patient is unwilling to participate in any activity. With these patients, the volunteers have to be very persuasive.
Tonight, I always take a nap in the afternoon at this time.
You do?
Yes, I do.
Oh.
And I don't like to miss my nap.
Well, I hate to bother you, but I think it's good to keep you awake in the afternoon so you'll sleep better in the evening.
No, I don't want to hear it.
Be enthusiastic but firm, and enlist the support of the elder life specialist, the doctors, nurses, and family members as you repeat attempts to get the patient involved. Schedule a time to return and try at least 3 times before accepting the patient's refusal of the intervention. Make sure to document the refusal and report it to the elder life specialist as soon as possible.
Is there anything I can get for you that might make you happy? I could get some music for you to listen to.
What kind of music?
Well, we have big band music, we have
Yeah.
classical music.
What kind of classical?
Well, just general classical, violins.
All right, if you want to.
Mrs. Morris, I'm going to check on that news.
As you conclude any daily visitor session, make sure to do the following. Review any questions or concerns to make sure you understand what the patient is asking for. Review what action you will be taking about these questions. Remind the patient, using the orientation board, about the name of the next volunteer who will be coming to visit.
And Lorenzo, the afternoon volunteer, will be in a little bit later.
All right. Thank you.
You have your call button there
Yes.
and your book.
Make sure the call bell is within the patient's reach before you leave. If you've closed the door or pulled the privacy curtain, make sure you open them as you leave so that the patient will not feel isolated. Say goodbye and leave. Wash your hands after you leave the room.
Very recently, we had a patient in the Elder Life program where the family member actually came up to me and sought me out in the hospital to tell me how much the program had benefited her mother.
Although it only takes a few minutes, the Daily Visitor program can have a meaningful impact on patients' lives.